Rheumatologist, we ask the question, can you cure osteoarthritis? As a brief review, osteoarthritis is the most common form of arthritis. It affects somewhere between 10 to 15% of the population, with more common joints including the back, hips, knees, and certain joints in the hands. Most people with osteoarthritis will describe having pain, which is worse with activity and improves, although it doesn't totally disappear always, with rest. People with osteoarthritis will have stiffness sometimes in the morning, which typically lasts less than 30 minutes. Rarely, although it can happen, they might have a joint that swells, although certainly they may have some bony enlargement. And because of all this, it can impact day-to-day function. So the question is, can we cure osteoarthritis? And as of now at least, the answer remains no. There is currently no cure for osteoarthritis, and unfortunately there is also no treatment for the underlying condition itself. So we can't change what happens with osteoarthritis. Therefore, treatment really is focused on two things. It's focused on reducing pain and focused on improving day-to-day function. How do we do that? Well, there's lots of different modalities, and some people like to try one or two, although often you can mix a number of these together for what works best for you. So when we talk about non-medication modalities, there's things like weight loss, providing more support to a joint through either a brace or splinting it. Some people may need walking aids to help relieve some pressure on a joint, such as a cane or a walker. Certainly, exercise is really important as it helps maintain muscle strength around a joint. We know weaker muscles around a joint likely is going to add to pain and likely decrease function. Sometimes working with a physiotherapist can help in this regard. Heat or cold therapy may be helpful. And water therapy, particularly since it takes care of gravity, removes gravity from the situation, can be particularly helpful for lower limb osteoarthritis. When it comes to medications, things like acetaminophen, Tylenol, ibuprofen, Advil or Motrin, naproxen, Aleve, all over the counter, may be beneficial, taken in appropriate dosing. If they are not, speaking to your primary care physician or specialist about prescription pain relievers, be it stronger strengths of these named medications or other ones, may be appropriate. In some cases, there are medications that can be injected into joints, which can be helpful and may last for months, if not years, if they're effective. And of course, if none of these things work, despite giving a good try at them, that might be a time to discuss joint replacement with your doctor. But again, the keys for joint replacement are really around uncontrolled pain despite other attempts and poor function despite other attempts. For more detailed information on any of this, osteoarthritis and its treatment, please feel free to view our other videos or visit us at our website at albertarheumatology.com.